Coming up in the news, some islands placed on a new curfew and the nation's leader outlines plans to further combat COVID-19. Also, hear how the government plans to honor the memory of the Honorable Arthur D. Hanna. And is the Delta variant in country, and how does this impact those fully vaccinated? The Bahamas Tonight, the Northern Edition, starts now.
This is the Bahamas Tonight, Northern Edition.
Good evening, Bahamas. I'm Shoshana Wolf-Arkeson. As always, it is so great to have you with us. Topping news tonight, Grand Bahama among islands to be placed under new curfew hours. This comes as the nation's leader, Prime Minister, the Most Honorable Dr. Hubert Minnis, announced new restrictive measures during a national address on Monday night. The Prime Minister also giving details regarding additional vaccines for the country and his administration's plans for the country's future transition to a new legislative approach. Jamila Mizik has our top story.
Prime Minister the Most Honorable Dr. Hubert Minnis addressing the nation about the government's plans to further combat the deadly COVID-19 virus. The nation's leader notes that while there is no confirmation that the Delta variant is in the Bahamas, out of an abundance of caution, the government must act accordingly, as the current surge has taken the public healthcare system to its limit. He says to help combat the spread of the virus, on the advice of health officials, effective Wednesday, August 11th, new curfew hours will commence on some islands, including Grand Bahama.
On Exuma mainland, the curfew will be from 10 p.m. to 5 a.m. On Abaco mainland, curfew hours will be from 10 p.m. to 5 a.m. On New Providence and Paradise Island, the curfew hours will be from 9 p.m. to 5 a.m. On Grand Bahama, the curfew hours will be from 9 p.m. to 5 a.m. The curfew on North and South Eleuthera, including Harbor Island, will continue to be from 10 p.m. to 5 a.m. I wish to note that the curfews will be strictly enforced and that enforcement is being increased.
Continuing his appeal to residents to get vaccinated, Dr. Minnis adds that negotiations have been concluded to bring in a substantial number of new vaccines.
Along with these new doses and the vaccine supply we already received, over the next few months, we will have the capacity to vaccinate all Bahamians and residents who wish to receive the vaccine. But let me be clear. COVID-19 will not just disappear. What our vaccine supply will do is allow us to give a significant percentage of our population protection. This will in time lessen the likelihood that we will have large-scale surge that cause extremely high hospitalizations.
Dr. Minnis notes that getting vaccinated is key to fully opening the economy, adding that the Bahamas has seen significant economic growth in recent months. He says, depending on the state of the pandemic, it was the government's intention to move toward concluding the use of the emergency orders this month and transition to a new legislative framework as more Bahamians were vaccinated.
The surge in new cases, hospitalizations, and deaths have required us to temporarily adjust our plans in order to immediately save Bahamian lives and to protect our economy. My government has set a plan to further combat this wave and to transition the country to a new post-emergency orders regime after this deadly surge subsides. As a result of the arrival soon of new vaccine supplies, we will be able to begin the transition process away from the emergency orders. Tonight, I wish to announce that my government will seek the approval of Parliament for one final extension of the emergency orders. This will be the last extension of these orders. After approval by Parliament, I can announce that the emergency orders will end at the very least November 13th, 2021.
Prime Minister Minnis says the government will be tabling in the House of Assembly the Public Health Emergency Preparedness and Management Bill 2021 for consultation, and he is encouraging the public's feedback. Now, Dr. Minnis says the government is not going to make vaccinations mandatory. However, he's urging those vaccinated to encourage the unvaccinated to get the jab. Jamila Misick, ZNS Network News.
Now, as the Bahamas experiences the worst surge in COVID-19 cases since the start of the pandemic, some residents on Grand Bahama are in agreement with the new restrictive measures, while others say more consideration should be given to those who will be directly impacted by the new curfew. Ramiko Knowles fills us in.
New measures expected to combat the spread of COVID-19 coming into effect on Wednesday, August 11th. The Prime Minister stating that it was the government's intention to bring an end to the emergency orders this month, but the decision was made to extend it until November 13th. For the most part, residents of Grand Bahama are in support. The country's COVID-19 death toll is over 300 and hospitalized cases are on the rise. For that reason, Carolyn Roll says she believes the Prime Minister is making the right decision.
I think it's needed at this time. During what's going on with the uprise in the cases, I think it's really needed. And I think it'll be better for the country.
Regarding the extension of the emergency powers order and the new 9 p.m. curfew, Archie Carey says something had to be done.
We just don't do anything, it'll be worse, So I feel it's needed, I feel the restrictions, I feel it needed until things drop down,
But there is a concern from a business owner. Executive Director of the YMCA, Karen Johnson, says while she is in support of anything that will save lives, the 9 p.m. curfew is going to be tough on businesses.
That's hard. That's truly hard because every time the hours of operation is cut, the only persons who really feel the brunt of it is employees because our times are then cut. But the operation still continues. So it has to be some consideration when making, decisions where.
An employee of a local restaurant who works the evening shift believes the new curfew may affect her employment.
The restaurant opens 6 to 8. So people ain't coming to dine late as that, as early as that because the sun's so bright. So now they're going to leave us without a job.
But given the country's economic state, residents agree that the restrictive measures are needed.
I know it's hard on him making that decision and watching this country I don't know, it's just tough on him, and Lord be with him.
If the curfew is what we need to slow down the spread, we have to do it. 9 o'clock isn't too bad. Most of the places shut down anyway around that time.
I'm managing very well, getting a lot of needed rest, so it's working well for me.
And our hospital now is burdened with the amount of COVID patients. So I, for one, don't want to be one of those individuals who want to take a chance and then not be able to get the service. So I vaccinated, and I encourage anybody out there to be vaccinated as well.
Rumiko Knowles, ZNS Network News.
Well, the House of Assembly reconvening today as the government seeks the approval of Parliament for the final extension of the emergency orders that will end on November 13, 2021. Prime Minister, the Most Honorable Dr. Hubert Minnis, tabling a resolution in Parliament this morning.
Now, therefore, be it resolved that this House A approves the continuance in force of the proclamation made on the 14th day of May 2021 until the 13th day of November 2021. B, affirms the continuance in effect of the emergency powers COVID-19 pandemic management and recovery regulations 2021 made on the 14th day of May 2021 until the 13th day of November 2021. C, affirms the continuance in effect of the emergency powers COVID-19 pandemic management and recovery number 2 order 2021 made on the 22nd day of June 2021 until the 13th day of November 2021, and D, affirms the continuance in effect of emergency powers COVID-19 COVID-19 Pandemic Management and Recovery Special Provisions Order 2021, made on the 16th day of May 2021 until the 13th day of November 2021.
Now, during the sitting, the nation's leader also offering condolences to the family of the late Arthur D. Hanna. Prime Minister, the Most Honorable Dr. Hubert Minnis, noting that the country lost a Bahamian giant and a statesman. The Prime Minister adding that Hanna gave his life for the Bahamian people through the struggles of majority rule and independence. This is why, he says, the government will honor his legacy in a most fitting way.
I remember him constantly fighting for opportunities for all Bahamians in every sector of our society. This fight for opportunity continues in each generation. We are inspired by his legacy and by his constant and unshakable faith in Bahamians, so that we can remember the contributions of the Honorable A.D. Hanna, Mr. Speaker. A new $100 bill bearing the face of A.D. Hanna, replacing that of the Queen, will commence and be issued officially in the Bahamas in 2000.
Well, leader of the opposition, Philip Brave Dave, is also congratulating the government on the move.
All Bahamians. I do recall, and it is fitting, I think that I congratulate the government for seeing fit to have a face on the $100 bill, the substitution of the Queen. Because though the Most Honorable A.D. Hanna understood the trappings of the Westminster system, and understood the colonial rule under which we all endured, we also recognize that at the end of the day, we as a people ought to carve out our own identity.
Well, the nation's leader adding that the government is also in discussion with Hanna's family to honor his life with a state funeral. Bahamians are being encouraged to err on the side of caution, particularly with the possibility that the Delta variant could be in country. Tonight, the head of the Grand Bahama Task Force shares why this is a major concern for health practitioners and what even those who are fully vaccinated must do. COVID-19 numbers continue to rise. The Delta variant remains a concern among many. Health officials say as this pandemic evolves, one thing is certain. This variant is responsible for the increase in hospitalizations and deaths regionally.
It's just a matter for us now of making that assumption, because if we don't, we're not going to do the right thing. And we still have a lot of persons there now who are not sensitized as to the infectious rate of the Delta variant. There's still a lot we don't know about it. What we do know, and what's coming out in the literature now, is that yes, everybody knows it is much more easily transmissible, but there are reports coming from other jurisdictions now that it is not only much more transmissible, but is accounting for a lot of the hospitalizations, and in some different jurisdictions is responsible for a lot of the deaths.
But whether or not the Delta variant is here remains to be seen. However, Chairman of the Grand Bahama COVID Task Force, Dr. Frank Bartlett, says samples have shown that there are other COVID variants in the country.
National Reference Lab, we're doing several things, and samples we would have sent off to regional labs to do the genomic studies. So this is where you look at the virus in and of itself, look at and pick apart the gene structure to identify which variants they have. From the ones that we would have sent, we didn't detect. Most of them are coming back as labeled variant, but they're not labeled as the Delta variant.
And if you are fully vaccinated, you're being asked to heed this warning just as those who are unvaccinated.
Those vaccinated still wear your mask, okay, because we don't have full coverage, full protection from the Delta variant with the vaccines that we're currently using, and even the ones you would have gotten in the States, the Pfizer, the Moderna, the Johnson & Johnson, you don't have full protection. So you're still at risk for getting the Delta variant, even though you may have been fully vaccinated. So you have to be able to understand that. And so social distancing, wearing your mask, still becomes very, very important.
The latest COVID-19 dashboard reporting 121 new cases in the country, 97 in New Providence, 11 in Grand Bahama, 6 in Exuma, 3 in Andros, 2 in Eleuthera, and 1 each in Abaco and the Berry Islands. Hospitalizations are at 134. 26 of those cases are here on Grand Bahama, including 3 in ICU. The Ministry of Health is also reporting 1 additional death, a 64-year-old male of New Providence who died on August 9th. The death toll now stands at 308, with 38 deaths under investigation. There are 2,546 active cases and 12,942 cases have recovered. In news from the crime beat, police officials investigating a stabbing incident over in Grand Key, Abaco. According to reports, on Tuesday, August 10th, police received information that a man was stabbed while at the government dock. Initial investigations revealed that the male got into a verbal altercation and was stabbed to the left shoulder by a male known to him. The victim was taken to the Grand Key Clinic and was later transported to the Rand Memorial Hospital. He is listed in serious but stable condition. An adult male of Grand Key, Abaco is assisting police in this matter, and investigations are continuing. Stay with us. We'll be back right after this.